New pandemic scary in world, what is this COVID-like HMPV virus in China? In the wake of the COVID-19 pandemic, the global community has remained on high alert for emerging infectious diseases. Recently, reports from China have brought attention to another respiratory virus causing concern, Human Metapneumovirus, HMPV. While HMPV is not new, its recent surge in infections, coupled with its COVID-like symptoms, has ignited fears of a potential new pandemic. Before we get started, subscribe to our channel and turn on the notification bell so you never miss our latest content. What is Human Metapneumovirus, HMPV? Human Metapneumovirus, or HMPV, was first identified in 2001 in the Netherlands, although subsequent studies suggest it has been circulating in humans for decades. It belongs to the Pneumoviridae family and is closely related to respiratory syncytial virus, RSV. Both are leading causes of respiratory tract infections in children, the elderly, and immunocompromised individuals. HMPV primarily targets the respiratory system, causing symptoms ranging from mild cold-like issues to severe pneumonia and bronchiolitis. The virus is especially dangerous for vulnerable populations, including infants, older adults, and those with weakened immune systems. It spreads through respiratory droplets, direct contact, and contaminated surfaces, much like other respiratory viruses. Transmission and symptoms. HMPV spreads through respiratory droplets, much like influenza and COVID-19. It can be transmitted by coughing, sneezing, or touching contaminated surfaces. The symptoms of HMPV are similar to other respiratory viruses, which can make it challenging to diagnose without specific tests. In severe cases, particularly in immunocompromised individuals, the elderly, or young children, HMPV can lead to complications such as pneumonia and bronchiolitis. Recent outbreak in China. What is happening? In late 2024 and early 2025, Chinese health authorities reported a notable rise in respiratory illnesses attributed to HMPV. Hospitals in major cities, including Beijing and Shanghai, have seen a surge in patients presenting with severe respiratory symptoms. The timing, coinciding with winter and the respiratory virus season, has added to the strain on healthcare systems. Global response. The World Health Organization, WHO, has classified the HMPV surge in China as an event of interest, urging countries to increase surveillance and laboratory testing for respiratory pathogens. Additionally, researchers are working to understand whether environmental factors, population density, or other variables contributed to the outbreak. In the meantime, governments worldwide are reviewing pandemic preparedness plans to ensure readiness for any eventuality. Lessons learned from COVID-19, including rapid testing, contact tracing, and vaccine development, could prove invaluable in addressing HMPV or similar threats. The current outbreak also underscores the need for continued research into respiratory viruses. Developing vaccines and antiviral treatments for HMPV could prevent future outbreaks and save lives. While the rise in HMPV cases in China is concerning, it is not yet a pandemic. However, the situation serves as a reminder of the unpredictable nature of infectious diseases. Vigilance, preparedness, and cooperation will be critical in managing this outbreak and preventing a global crisis. As the world continues to recover from the COVID-19 pandemic, it is imperative to strengthen healthcare systems, invest in scientific research, and foster a culture of proactive health management. Only through these efforts can humanity effectively combat the ever-present threat of infectious diseases like HMPV. If you enjoyed this video, give it a thumbs up and subscribe for more content. Hit the notification bell to stay updated with our latest videos. Share your thoughts in the comments below. Thank you for watching.